What is the ketogenic diet? Is it good or is it bad for you? Either way, why? What is it that makes it good or bad? In order to understand the ketogenic diet, we must first start by understanding what a diet is altogether. Your diet is the food you put into your body. It is what fuels your body to make energy. The actual phenomenon of making energy happens when your body breaks off a piece of a special molecule. Upon breaking off that piece, a jolt of energy is released that your body can capture and use. Then, in order to get more energy, your body has to replace that molecule using the food that you ate. This process allows us to constantly repeat the energy-making cycle over and over. So next, let's talk about what the different kinds of foods do inside your body. There are three main categories of nutrients: carbs, fats, and proteins. They're each individual, unique units that get broken down differently. Carbs can be used as energy for everything, but they're special because the brain, the red blood cells, and the spinal cord use them specifically. The brain, red blood cells, and spinal cord cannot use proteins and fats for energy. That's why the carbs are special for them. Fats are very important because they are what makes up cell membranes and are also used to transport different nutrients and signals throughout the body. Proteins are arguably the most important because they are what makes up your muscles, your organs. They're responsible for most reactions that happen in your body, and most importantly, they function directly with your DNA. So what foods are carbs, fats, and proteins? Well, carbs can be found in so many things. That's why the RDA recommends you eat majority of your calories in carbs, because if you eat a healthy amount of whole grains, fruits, vegetables, and dairy every day, then you'll be eating a lot of carbs, and that's okay because that's what your body prefers. Different kinds of fats can be found in meat, dairy, nuts, avocado, and olives, and different kinds of protein can be found in meat, dairy, beans, soy, and legumes. As you can see, some foods like dairy have all three components in it. That needs to be taken into consideration whenever you're planning your own diet. So let's go over what is recommended for you to eat. The recommended daily allowance, known as the RDA, which was made by the Food and Nutrition Board of the Institute of Medicine, says that an average healthy adult should get 45 to 65% of their calories from carbs, 10 to 35% of their calories from protein, and 20 to 35% of their calories from fat. This is the RDA. This is the gold standard recommended daily allowance of what you should be eating every day. So what is the ketogenic diet? The ketogenic diet is an ultra-high fat diet with less than 4% of calories coming from carbs, 12 to 42% of calories coming from protein, and a whopping 60 to 80% of calories coming from fat. I do want to point out that these ranges can be narrowed down to a precise number for each individual depending on their age, their height, their weight, and their health status. Here's a nice visualization of the macronutrient breakdown of a normal diet on the left versus a keto diet on the right. As you can see, the keto diet cuts out almost all of the carbs, replaces them with fat, and increases protein a little bit. So on the keto diet, you're nearly cutting out all carbs out of your diet, which means that you're cutting off your body's supply of immediate energy as well as the energy used to fuel your brain, red blood cells, and spinal cord. So how do the fats and proteins make up for the lack in carbs? The three macronutrients that I mentioned earlier all break down differently since they are totally different molecules that perform different functions. The Krebs cycle, shown as the recycling green arrows, is a system used to make more of those molecules that are broken up to make energy. Under normal diet conditions, carbs are able to enter the Krebs cycle very easily and be used as an immediate source of energy. Proteins are broken down and will most often skip the Krebs cycle since your body doesn't need to go through the inefficient process of turning them into energy. Instead, they get used generally in various metabolic functions throughout your body. Fats can either skip the Krebs cycle and be used for metabolic functions, or it can enter the Krebs cycle and be used for energy. So, under ketogenic diet conditions, there's no carbs, which means that you have no supply of immediate energy. So, your body has to go on an emergency backup plan for supplying energy to your brain, red blood cells, and spinal cord. The protein are forced to go through the Krebs cycle to make energy instead of being able to be used for metabolic functions. What's really crazy about this is that one piece of the protein simply gets taken off and thrown away, and that piece is the part that makes proteins special from carbs and fats. It's literally just getting tossed in the garbage in your urine whenever you're using your protein as energy instead of for metabolic functions. So under ketogenic conditions, fats are still going to go through the Krebs cycle for energy and will also be used for metabolic functions. Since the ketogenic diet increases the amount of fat consumption by around 40%, your body has to burn a lot more of it. So yes, it is true that the ketogenic diet will make your body burn more fat, especially considering the fact that you're eating 40% more fat. Just maybe not as much as getting burned from the excess fat the people on this diet are usually trying to get rid of. It's usually coming from what you're actually consuming. So are there any consequences of keto? Of course. There's positive and negative consequences. First of all, your body will have no more immediate fuel sources. All of your carbs are gone, so your body will have to switch into a less efficient method to create enough energy for you. Your body does not want to burn protein for energy. It prefers to burn fat and carbs for energy. When your body has to use protein to make energy, it takes the one thing off that makes it different from carbs and fats, literally throws it away. The most expensive part of the protein gets peed out and the rest gets used for energy. Another consequence is the buildup of ketones. One component of the Krebs cycle is actually a derivative of a carbohydrate. In order for your body to be able to make energy via the Krebs cycle, it has to have a certain carb. When you cut out carbs from your diet, your body will use the storage supply you have in your muscle and liver to supply the carb derivative for the Krebs cycle. Once it runs out of that supply, the proteins and fats cannot move the Krebs cycle and instead are made into ketones, which serves as a temporary emergency source of energy for your brain, red blood cells, and spinal cord. Again, this is an emergency source of energy. This is not a preferred method of ketones or of energy. So what happens when ketones build up? Well, this causes very stinky breath, known as acid breath, since your body is having to breathe out the extra acetone that's a byproduct of the ketone formation. Also, if too many ketones build up in the blood, what was nutritionally induced ketosis may progress to ketoacidosis, which can cause major organ failure and even death. Other symptoms associated with the buildup of ketones are nausea, vomiting, abdominal pain, lack of energy, and confusion. So let's talk about what the research shows about the ketogenic diet. Research shows that a moderate fat diet, which is still a high fat diet around 60%, but not quite as high as 80% of the ketogenic diet, is better because it's not as extreme. Although it does produce the same results as a ketogenic diet, it's just a little easier to adhere to because you're not as limited in your food choices. There's also some evidence that a specialized ketogenic diet may be useful in preventing the growth of cancerous tumors. Other evidence shows that a keto diet may be an effective treatment for epilepsy, and there's many research that shows the effectiveness of the keto diet on decreasing your body mass index and preserving your lean mass. However, I do feel the need to point out that during these research trials, doctors monitor the participants very closely. I'm bringing this up because if the professionals are careful to monitor those whom they put on this diet, then so should you if you decide to go on this diet. Many stores have these at-home urinary test strips that test for ketones. They're very affordable and easy to use. There's no reason not to purchase and use these if you're going to do the keto diet. So to recap what we just went over, we talked about how food is used as the fuel for energy. We talked about the 3 different macronutrient categories of carbs, fats, and proteins, and how they are each used and broken down differently. We talked about the potential negative side effects of the buildup of ketones that may result while on the ketogenic diet, And we talked about the evidence for benefits of ketogenic diet in people with epilepsy, some cancers, and obesity. So finally, what is the ketogenic diet? It's basically an extremely high-fat, low-carb diet. Is it good or bad for you? It depends. Many factors contribute to the pros and cons of this diet, so whether it's good or bad is determined on an individual case-by-case basis. And why? Well, it's bad if it's managed improperly or if underlying conditions are present. But it can be good for special cases if it's managed and monitored properly. So using this information, how do you decide what to eat? The best method is to see an expert nutritionist such as a registered dietitian. If you're unable to seek professional help, then consider your state of health, your goals, and what you're capable of managing. Also, consider the RDA and USDA's recommendations for healthy eating, such as increasing your fruit intake, increasing your vegetable intake, increasing your fiber intake. Those are really good recommendations that the RDA and USDA have put forth. And that's all, folks. Thanks for watching. My name is Kelly, and I'm a soon-to-be registered dietitian. It has been my pleasure to break down the ketogenic diet for you.